Hi, welcome to What the Freud. My name is Gypsy Roach. Today, we're diving into a critical topic that impacts millions, the dangers of misdiagnosis in the medical and psychiatric fields. Picture this. Researchers conduct a study in a community of 112,000 people. Among them, they find 91 that have multiple sclerosis. But here's the twist. When they checked the psychiatric records, they found that 15 of these 91 MS patients had been referred to psychiatrists before being diagnosed with MS. Out of the 15, 10 were showing symptoms actually that were due to MS. So you might ask, why does this happen? Well, early MS symptoms can be vague and subjective. And if the doctor believes that the patient is exhibiting histrionic behavior, or if they have a psychiatric disturbance, it can cause the doctor to overlook the physical issues. So you might be wondering, what do you mean by histrionic? Histrionic traits are in the eye of the beholder. If the doctor sees you as attention-seeking, if they find your behavior overly dramatic or emotional, then they may see you as histrionic. It's important to note that this is more often attached to women than men. It can also be applied to people in certain cultures where they are very emotive and expressive in their communication style. This leads to misdiagnosis and improper treatment. So let's talk about psychiatric disturbance. These are conditions affecting the mood, thinking, behavior, or the ability to relate to others and function. They include depression, anxiety, schizophrenia, personality disorders, substance abuse, PTSD, and ADHD. Now, did you know depression affects about 264 million people globally? Anxiety, 284 million. Up to 3% of the population is affected by PTSD. These numbers predate COVID, by the way. Now, misdiagnosis can trigger a cascade of problems. Patients might receive ineffective or harmful treatments, while the real condition progresses untreated, leading to more severe health issues or even death. Here's the kicker. While healthcare professionals should exercise caution and perhaps even refer patients out for a psychiatric evaluation, this isn't always the case. Often it's up to the patient to identify when they've been misdiagnosed. In my own journey, 8 physicians diagnosed me with a mental illness before I finally found a specialist who recognized that I had a rare neuromuscular disease called Myasthenia Gravis. It was uncomfortable to receive so many mental illness diagnoses, and it was uncomfortable to challenge so many doctors. There's so many degrees that I was disagreeing with. I was lucky. My type of Myasthenia Gravis is not typically fatal. But patients with multiple sclerosis aren't so lucky. There's much more at stake if they're misdiagnosed. MS is one of a set of multi-system autoimmune disorders that contribute to the leading cause of death for young to middle-aged women. Only a doctor with an overconfidence in their knowledge and their technology would dismiss physical symptoms as psychiatric. When that happens, the burden is on us as patients to find another doctor, get another opinion, and keep fighting. I believe there are only 2 acceptable diagnoses to be given to patients. One is the disease, and the other is we don't know. I can live with we don't know. The link here will take you to the playlist where I tell my story of the fight to get a proper diagnosis. If you want more details, my book, Why Won't a Hysterectomy Cure Hysteria, is available on Amazon in Kindle and paperback formats. And I thank you very much for watching.